Okay, hello everyone. My presentation deals with the effect of bee honey on blood glucose level of Sudanese patients with type 2 diabetes mellitus. As you know that diabetes is a metabolic disorder with multifactorial etiologies with serious complications, and probably it is the oldest disease known to man. Nowadays, the medical world is turning more and more towards the health benefits of medical herbs and natural products. So honey is one of them. Honey composed of more than 200 compounds. For example, sugars, especially the monosaccharides, fructose, glucose, and also sucrose and other disaccharides, and rich minerals and vitamins as well, like ascorbic acid, thiamine, riboflavin, niacin, and others. Also, it contains many enzymes like those involved in carbohydrate metabolisms, diastase, amylase, and other enzymes, glucose oxidase, catalase, acid phosphatase, proteases, and others. Regarding medicinal effect of bee honey, many studies showed that honey has an antioxidant effect, hepatoprotective, cardioprotective, antibacterial, anti-inflammatory, and anti-tumor as well. To put the patient under restricted diet may prevent him or her from nutrients needed by the body, especially if the diabetic patient complains from other problems. And usually they use artificial sweeteners. Now the question is that, can the patient use honey as a sweetener and get the benefit from its high nutritional value as well as therapeutic effect and use it as natural sweetener? So our objective comes to determine the effect of bee honey on blood glucose level of newly discovered Sudanese type 2 diabetic patients, those who were non-insulin dependent, and compare them with healthy control. Also to test if bee honey can be used as a sweetener. The sample of bee honey in this study was brought from an area in Sudan, hand-to-hand delivery from the honey collector. The price of table sugar at that time was higher than the honey, so it is unlikely to be adulterated. Then honey sample was analyzed to test its genuineness and to specify the main sugars, which are fructose, glucose, and sucrose. Usually, to test the genuineness of honey, the parameters that are analyzed are pH, free acidity, total acidity, hydroxymethyl furfural, and water contents as well. Absence of hydroxymethyl furfural is an indicator of honey quality since it is produced from fructose decay due to heating or bad storage of honey. Also, the main sugars in honey were analyzed and all showed that the honey is genuine. Volunteers shared in our study were fully informed by the aim of the study, and a written informed consent were obtained from all of them. Clinical examination was done and data recorded. The exclusion criteria is that all ill patients or apparently ill patients or those with complications or physical disabilities or were excluded from the study. So we have two groups, control and patients. Control included 10 non-diabetic healthy volunteers, 5 females aged 29 to 57 years, and 5 females aged 28 to 50 years. The patients classified into 3 groups. Group 1 contained 29 patients, 15 males aged 30 to 67, and 14 females aged 24 to 57. Group 2 included 21 patients, 5 males aged 30 to 59, and 16 females aged 24 to 60. Group 3 contained 10 patients, 4 males aged 30 to 49, and 6 females aged 60 to 40. Actual involvement of patients in each test was according to circumstances surrounding the patient. I mean that some of them started the test and then they quit. They apologized to continue. Blood samples were taken from all subjects before the test before we giving the doses. Glycated hemoglobin and fasting blood glucose were determined. Then specific doses of either honey or a mixture of sugars that represent the same percentage that found in the honey. Also, glucose doses were given to both diabetic and healthy control. The test was as following. The first test, 108 grams of honey that contains 75 grams of sugars were given to the patients after taking fasting blood samples. Further blood samples were taken after 60, 120, and 180 minutes to determine the blood glucose level. A week later, the same test was repeated with an equivalent dose, that is to say 75 grams of sugars mixtures containing fructose 41 gram, glucose 30.8 gram, and sucrose 3.2 gram instead of honey. And blood glucose levels were determined at the same time intervals mentioned above. The second test, a dose of honey was given, which is 36 grams. It contains 25 grams of sugar. And a week later, the same test was repeated with an equivalent dose of 25 grams of sugars mixtures. That to say 13.7 grams of fructose, 10.3 grams of glucose, and 1.1 gram of sucrose. The third test, glucose doses were given as 50 grams or 25 grams, then blood glucose level was determined as mentioned above. Now we are going to compare the results of the high dose of 75 grams of either honey or sugars mixtures and 25 grams of either honey, sugars mixtures or glucose, and 50 grams of glucose. Regarding glycated hemoglobin, all patients but one, only one had normal glycated hemoglobin percentage. All the others had high percentage. Now to compare the doses, these are the results. As we can see here in this histogram, the high dose of honey, which is 108 grams, equivalent to 75 grams of sugars. This is the fasting level. The blood glucose increased and then decreased a little bit, but is still higher than the fasting level. The same results we got it regarding the high dose of sugars, which is 75 grams. At the end of the time, the blood glucose level is still higher than the fasting level. Also, the 50 grams of glucose showed the same pattern. Blood glucose level increases and then a little bit decrease, but still higher than the fasting level. Now, what happened regarding the low dose of 25 grams of either honey or sugar mixtures? Both honey and sugars mixture at low doses, they didn't cause significant rise in blood glucose after 1 hour, and the blood glucose level dropped below the fasting level after 3 hours. As we can see here in the histogram, the blue one is the honey. This is the fasting level, and at the end of the time, up to 3 hours, it decreases below the fasting level, as well as the mixtures of sugars that contain 25 grams. Here is the same result, but we put it as percentage. This is the fasting level of either honey or sugars. At the end of the time, they showed lower level than the fasting one. And same thing occurred regarding the control. This is the honey and this is the sugars. it increases a little bit and then decreases below the fasting level. I mean the low dose of 25 grams of sugar. And same thing occurred regarding the control volunteers. Now, if you compare the low doses of honey, sugar mixtures, and glucose, we can notice that both honey and sugars mixtures, they didn't raise the blood glucose level significantly after 3 hours, unlike the glucose alone, which gave sharp rise after 1 hour and remained relatively higher than the levels obtained by honey and sugars mixtures, as we can see here in this histogram. This is the glucose, the starting point, fasting level, and at the end of the time, it gives the same level. Based on literature, now just to say, to try to discuss the results, why did this happen? From literature, it is said that many studies showed that fructose may play a role in lowering blood glucose level by different mechanisms. For example, increasing glycogenesis, decreasing glycogenolysis. It may have a synergistic effect with glucose. It may reduce food intake and increase insulin secretion as well. The first one, increasing glycogenesis, this is a pathway. Low dose of fructose may decrease activate the glucokinase enzyme and glycogen synthase enzyme, so it may increase the glycogenesis pathway. Also, low dose of fructose may decrease glycogenolysis by suppression of high phosphorylase, then no more glucose is formed. Also, it is found that absorption of fructose increases when equal amounts, but just in moderate or low concentration of fructose and glucose. If they are given simultaneously, they will increase the absorption of fructose. Fructose also may reduce food intake. The gastric emptying is prolonged by fructose intake, which may slow the rate of intestinal absorption. So it may reduce weight gain. Fructose also is found to stimulate insulin secretion, and honey is found to have a hormonal-like effect. It acts like insulin, honey itself. Some studies said that long-term honey feeding in rats, it may produce a significant decrease in glycated hemoglobin. Minerals in honey also play a role, like chromium, copper, and zinc. They reduce blood glucose through their action on insulin. Moreover, trace element deficiency are associated with oxidative stress, which eventually leads to insulin resistance diabetes. Also, honey is found to protect pancreas. Maybe the action or the mechanism, again, is the protection, I mean, against oxidative stress, because it has many antioxidant molecules like vitamin C, phenolic compounds, minerals, catalase, peroxidase, glucose oxidase, flavonoids, and carotenoids. Honey also is found to reduce appetite, maybe by delaying the postprandial ghrelin and enhance total peptide YY. In addition to that, honey is found to improve the lipid profile. It lowers triacyl glycerol and low-density lipoprotein glycerol and increasing HDL cholesterol. Also, some studies showed that honey may reduce homocysteine value. And as we know that homocysteine may increase the risk of myocardial infarction, stroke, and venous thromboembolism. From this study, we can conclude that bee honey at low doses equivalent to 25 grams of sugars decreases blood glucose level below the fasting level after 3 hours. Bee honey supplementation in individuals with impaired glucose tolerance or who are at pre-diabetic stage may delay or prevent the development of diabetes mellitus. Now we can recommend that low doses of genuine honey, approximately 3 tablespoons, can be recommended for diabetic patients as a sweetener, beside its high nutritional value, instead of using the so-called diabetic food, which offer no metabolic advantage and often have side effects. We can say that also we need further longitudinal studies, including more sample size. These are the references. At the end, I'd like to express my gratitude to my supervisor, Prof. Mustafa Idris al-Bashir, and my family, especially my soul of my father, my husband, and to all diabetic patients and healthy controlled involved in our study. If you allow me again, I want to say that honey is mentioned in Holy Quran more than 1,400 years ago. God tells the bees that to go to mountains and to trees to get nectar and to produce honey, which has